if you keep on ignoring it and ignoring it, oh, you know what, it went away, and then suddenly you're in your 10 years after, you're like, oh my god, this is so much. Why didn't we do it? Yeah.
All right, looks like we are live. Hello, badass athletes. We're here again for another live show. This time, we're going to have our physical therapist, Janise, to talk about low back pain. And I know, I hope you're not one of them who's actually having low back pain right now. But if you are, that sucks, because I was one of you guys too. Like, it could be like cycling, running, or even swimming, or even if you're not doing anything, or even if you're just sitting down or just laying on your bed. Actually, that's how I was back then, watching a Netflix. I'm like, ow, I don't know how to lay my back on this very comfortable bed. But before we go further, I want to introduce you, Janise Alcantara, physical therapist. She is actually specializing in orthopedic manual therapy. And guess what? What I love about Janise, because she is one of the big game changers when I did my second world record last year, when I finished 23 full Ironman distance in 34 days. And so that's a total of 55-mile swim, 2,500-mile bike, and 600-mile run in 34 days. So before anything else, I want to introduce physical therapy, Janise Alcantara. Thank you so much for taking an off from your work and family and a lot of other co-curricular activities that you're doing. Thank you so much for being here on this live call, because we are so excited to talk about low back pain, because a lot of athletes are actually looking for help. How are you doing today, Janise?
Good. And thank you for having me. I'm very honored. And of course, I was very honored to help you as well with that record. Up to now, I still can't fathom how you did it.
Me too.
Because that is pure willpower, I think. But of course, yes, very honored to have you and answer everyone's questions about low back pain, which I'm sure all of us has gone through an episode of one or two, including me. So here to answer everyone's questions and how physical therapy can help you.
That's very nice of you, Janise. Well, let's welcome also Carolina, Andrea, Chris. So if you're watching this one live, hashtag live. If you're watching this replay, hashtag replay. So low back pain, it sounds so simple, but then when it's painful, it's just, some of my athletes couldn't even actually walk or do regular activities. So tell us, Janise, what could be the trigger or cause of low back pain?
Okay, so in the physical therapies, for in our field, what you want to distinguish is the first thing we do when you come in for low back pain, when we get I have low back pain, is you want to make sure, is you want to identify, is your back pain really truly mechanical? Mechanical means it's coming from something musculoskeletal, or it's a movement issue, it's a biomechanical issue, or is your low back pain coming from something that's more visceral, something that's more serious, which is beyond a realm already? So that's the first thing you got to remember. We physical therapists are trained for is that we can screen a patient whether your back pain is truly something that's triggered by your physical activity. Is it something that we can treat? And that's the first thing we just got to determine. Not all back pain are the same. So, low back pain is just something that's a very general term, but there are so many different kinds of low back pain. When I'm saying mechanical low back pain, that means it's something coming from your lumbar spine because of something pathological or something changing the way your spine moves, if there's a structural issue like that. But if your back pain is coming because you have an aortic aneurysm, then that's a totally different story, right? Or if somebody who has, God forbid, somebody who has cancer, then that's a totally different story. It's not something within the realm of physical or orthopedic manual physical therapy.
Gotcha. So there's like a sciatica, herniated disc, performance syndrome, slip disc, SI joint inflammation. Are those like in the realm of low
Yeah.
back pain,
So
just
I think
different terminologies.
they're just much more easier for people to understand when
Sure,
you're saying, "Oh, I have piriformis syndrome because my body is really hurting. My piriformis is so tight,
sure.
and then it's causing my sciatic nerve to get impinged. That's why I have all these symptoms going down my legs." So
Yeah,
it's just a
yeah.
description of how a patient's feel. It's validating what a patient is feeling,
Okay.
but what we physical therapists figure out is why is your piriformis tight to begin with? What is going on in your spine that made your piriformis tight to begin with? I mean, doing a lacrosse ball, the tennis ball helps release it,
Right.
but if you can't figure out why your piriformis is tight, then it's going to keep on recurring, right?
Gotcha. Yeah, yeah,
And
yeah.
then if you have SI joint is also a very common culprit. It's a lot of, there's always that argument that, it's, does it move? Does it not move? There's all this biomechanical, there's this whole biomechanics of your sacroiliac joint, which is right behind me.
Yeah.
You see that right here? Okay.
Can you show more point what that is then? Just for athletes who are actually
Yeah,
not aware of.
let me get it. This one. So this
Okay.
is the back view.
Sure.
That's your sacroiliac joint. Okay. And if this is the front view, you see that line, that's your sacroiliac joint. Okay.
Mm-hmm.
Women and men, we suffer different issues. We are very different anatomically. You've had kids, it gets even,
Of
the
course.
differences, even you can,
Yep.
there's so many changes that goes on in there. So it gets ignored a lot because it's a segment that doesn't move very much. Um, its function is not very well explained nor understood by people. What is it really? What is the function of that SI joint? But if you think about it, there's a reason why it's so stable. It's
Mm-hmm.
supposed to remain closed, right?
Okay.
And so when you're running, that's where your energy weight shift. When you're shifting your energy or weight from one side to another, it has to pass through that, right? And so it's really crucial for mobility. And so when there's just an iota of less dysfunction in there, that could be a source of pain as well.
Mm-hmm.
So that's where, and then of course, if you're pregnant, for us women, and you've had baby and you've had all these pregnancy hormones, they're relaxing, so you tend to be a little bit more lax in there, so it's easy for you to have some kind of dysfunction in there.
Got you, got you. So, like for example, there are other symptoms, like for example, shooting pain down back on one leg, or numbness,
And
or when you're
yeah,
flexing
shooting
or
pain down
bending.
the leg. So
Yeah,
that is something that's not very well explained by
sure.
our sometimes very poorly understood by common. So people think, oh, I have the shooting pain. I have a nerve root compression.
Yeah.
So, my L5S1 says I already have severe narrowing in there. My nerve root is compressed, that's why I have shooting pain. What people don't understand is that when a nerve root is compressed,
Sure.
okay, there's only two functions is affected. Either you get numb
Yep.
or you get some kind of weakness,
Mm-hmm.
right? But it only causes pain if there is inflammation.
Got it.
And shooting pain, like usually when you say radiculopathy, radicular pain, the pain is usually very much in a very narrow path. It's like in a very narrow area of your back of your leg. It's not where the patient, it's my whole leg. That's a totally
Sure.
different story. And then it's usually when there's inflammation. So when there's inflammation and it kind of causes inflammation in the dural sheath, the covering the nerve roots, and so that's when it causes the radicular pain symptoms, kind of like that. It's like running, burning, shooting pain going down the leg. So
Sure.
that's why a doctor would say, okay, then get your anti-inflammatories, you get your steroids, or you get an epidural shots. That's where those work, because they're addressing they're addressing, what do you call it, that inflammation. But there's also another kind of pain where there's that heaviness, right?
Uh-huh. Yeah.
Like a patient would tell you, oh, I remember I was lifting a lot of things the day before and I was fine. I felt a little stiffness, but then I woke up the next day and I could not move. My leg was so heavy, right? There's a typical story that you would.
Yeah, yeah, yeah.
So that could be something that's more a potential disc issue, where you could have a slight disc herniation. And sometimes what happens is that materials from this disc can really go migrate and cause that inflammation. Okay, so there's specific exercises to do that, and then how to help decrease that, what we call an acute posterolateral disc herniation. So there are so many causes of back pain, like it's
how about overuse, like like what we do. What triathletes do, overuse, overdoing something with that cause.
We like to use that. I don't know why. What do you mean by overuse? So you mean if you think I never like that term because it tells people you're overusing something, and then what? You're gonna stop doing what you love to do. You're just gonna so you're gonna stop triathlon because you're overusing your back, right? Or we are made to move. We're not made to sit down.
Sure.
Right. And so overuse, to me, basically overuse means you're inefficient in how you use your body. That's basically what it means. Like you're using one set, but you're not distributing the work to the other part of your body. So usually I tell my patients, you know what, this part is overworked. This one is always on vacation. So it's time to give this one a rest and let the one who's been always on time off to turn it on. Right. And so that's where we kind of figure out how to do that neurologically. So, that's what overuse is. To me, that's how I
get it. Well, one of the things I wanted to share is that in one of the races, which I did the most Ironman at the time back then, 2016, I did an 8 Ironman in 8 consecutive days. And at the time I had a pinched nerve. Mm-hmm. And what happened was that it was just suddenly I started not feeling anything on my legs, like numbness and weakness. And then that's where I can't do anymore. And I had to pull back. So that's one of the experience that I had with that in relation to that one. Now, I want to welcome David Tess. Welcome again. If you're listening to this, #live, if it's live, and if it's replay, #replay. So now, let me see. Well, so there are a lot of different symptoms, right? Like, and also the common causes. So it's not necessarily like low back pain. It has to be in the low back pain. It could be on the legs too, right? Yeah. Like what we talked about. So when we feel something, what I'm getting at earlier is like when you feel something in relation to the symptoms that we just talked about, then I would think that go to a medical professional to actually check out what are the root causes. Is that right? And then the next thing is that you did mention about the lacrosse ball, the foam rolling. Those are good for a short term, but it would be better to actually check whether how can it be better, like long-term wise.
Yes, long-term wise.
Yeah, so, which is, I totally understand about that too.
A lot of misconception that I also hear are common is, my back is weak,
Sure.
My core is weak. I need to do core stabilization.
Yeah. Right? I heard a lot about that.
Do I need to do more planks? Mm-hmm. How many planks can I do? And I'm like, sometimes that's not the case. Stabilization will work if we can find that the cause of your back pain is functional instability. Then the core stabilization program will work, like a yoga, Tai Chi, you do Pilates, you do planking, you do your weightlifting, things like that. That could work. But what people don't seem to understand is, and I learned this very well from my orthopedic manual classes from Andrews and Earl Petman, is that there's this book called The Spinal Engine. So basically,
Spinal Engine,
yes. And this was done by a researcher in Canada, Dr. Grakovetsky, and he describes how it's like the watchmaker spring. Your spine is like, how you wind and it winds and it releases an energy.
Sure.
And he describes it because, like, have you ever seen anybody who has no arm and legs, right? But they could still move.
Yeah.
Have you ever seen a swimmer in the Paralympics with no legs and they can swim faster than you?
Because they can rotate.
They can rotate, right? Because they can rotate your spine. That's how much power your spine has. Mm-hmm. Right? That's how much energy and torsion your spine can generate. So it's not weak. But the question is, where does this energy that you generate when you are running, when you're walking, where does this generate energy that you generate dissipate to?
Okay. Where?
It has to be dissipate to your hips, to your knees, to your ankles, to the ligaments. But if you have biomechanical restriction in your hips, in your knee, and your ankle, because there's just a lot of things going on there, weakness here, prior trauma, or whatever things are going on in there, then that energy remains in your spine. And so where is it stored?
I mean, the spine, in the center, it doesn't dissipate.
Yeah. And in your vertebral body. Yeah. So it's not a matter of if, but when your spine will start to show some degenerative disc disease. And so you have these people that are questioning, but I exercise a lot, I do yoga, I do, all this and all that. Why do I have degenerative disc disease? I mean, so in actual, in physical therapy, we actually are trying to get away from the term degenerative disc disease, because everybody has it, but not everybody has pain, right?
Okay. Yeah.
Yes, things will degenerate as you get older, you lose your collagen, but how efficient is your musculoskeletal system? Okay, so if when I say that the spinal engine, right, and then there's just so much energy that your spine generates with your constant movement, where does this energy go to? If your hips are not up to it, your knees and your ankles and your ligaments are not up to it, that energy remains stored in your spine.
In the spinal column.
Yes, so
it's not used.
This spine is going to reach its maximum capacity, and then its maximum tissue storage energy potential, and then eventually it will just break down because it has reached its limit. It can only take so much force.
Yeah, the potential energy.
Yeah,
it just stays there.
The engineering people.
I know, that's what
I
understood it.
What is the maximum potential energy storage of any tissue, right? There's a limit. There's only so much one can take until it's so.
You have to be able to use it.
Yeah, so you have to be able to dissipate that. Gotcha. And you can't dissipate it if your hips lack the range. If you're not extending your knees. So that's where we come in, because then we can say, how does your hip contribute to back pain?
Gotcha.
So that's where it kind of gets, is it your hip that's causing your back, or your back causing your hip?
Right. Yes. So I think one of the sessions that we have is that you also mentioned the connection of the glute to the back, to the lower back. Do you mind explaining that more? Like if the low left glute is not turned on, I think it would be great if you can, I think, use that skeleton there. I don't know.
So we like to call it like the spine has the psoas to the muscle. So what happens when you have a disc issue and let's say several years ago, you've had a disc herniation, and that's fine now. You no longer have the symptoms down your legs, but you didn't treat it fully. You thought that since the symptoms are gone, you didn't working on the stability of your spine. And so it becomes a little bit unstable. So the ligaments are forced to do their work, to kind of do their stabilization work. But then eventually the ligaments are saying, I can't no longer do that much, when they become overstretched. So what's stabilizing your spine? So then it makes the muscles, especially your psoas around your spine, really pick that up, because they're all connected. And so it makes it what we call a facilitated. So the problem is when it's facilitated, which means it's always panicking, because it's detecting that, there's some instability going on. So it's in this facilitated state. And so when it's standing, what happens is that it's opposite antagonist, what we call functional antagonist. When you're standing, is the opposite glutes, or when you're lying down the same side, it's your glutes on the same side. And so it cannot fire, right? Because you cannot have two muscles going on at the same time. One has to be inhibited and the other one has to be contracting, right? So both of them cannot be constantly. And we're talking about neuromuscular. We're not talking about just turning it on, right? We're talking about when you're moving, when you're actually doing a functional motion. Okay, it's not just when you're bridging. That's a totally different story. So when you have your glutes that are inhibited, especially your piriformis in the femoral glute max, and they become inhibited, then you can control the rotation of your knee too much, right? And so then when you land, you're gonna go into this inward rotation on your knee, and that's when patient says, the inside of my knee is hurting, I got a meniscus tear.
Yes.
Or you're landing on your heel too soon, especially
Mhm.
the inside, because you can't control, because your glutes can't fire. And then there people gonna say, my heel, I think I have plantar fasciitis, or
Yeah.
I think I have metatarsal, I think I have a Morton's neuroma, or I have a bunion, things like that. So they're all related.
Gotcha.
And so it's that, that's why a lot of people are going into the glute strengthening. Oh, do your bridging, do your glute strengthening. But how can you turn that on if you don't even address your back? Are
Gotcha.
you even addressing the instability that's going on in your lumbar spine, in your low back? So if you want that glute to work well, you're talking about, when I say work well, what I'm talking about, does it turn on when you need it? Not turn on when you bridge, not turn on when you contract it, right? It's not about squeezing your butt. Does it work when you need it at the right time, at the right moment? You don't want it to work at not when you don't need it, right? So it's all about motor timing, motor endurance, and coordination as well. So, it's still all about neuromuscular function and how it fires in, so it's all a little bit about neuroscience in there.
Actually, I'm just gonna share this one here. Let me make sure that people actually see this one. This is one of the things that I had done with Janice during my visit to her office. It's called neuro.
Oh, the new rack.
Yeah, yeah. So one
Yeah.
of the things is basically, what she had taught me during my visit is that, like, I need to learn how to sense. Correct me if I'm wrong. My understanding, Janice. So I need to know when I sense signal or I activate my left glute so I can turn off my right lower back.
Yes.
That's
So yeah.
oh, okay, good. There you go. But it's not just like, you're doing the glute bridge, but more of like when I'm running, I need to be able to do something to get connected to this muscles that would actually help for me not to feel any discomfort on my lower back. And it even, one of the interesting things that she had brought up to me is actually, okay, well, when do you exhale? Do you exhale when you step on your right or left? And when I started thinking about that, well, yeah, I excel when I step on the right. But then at the same time, when I excel on the right, there is this connection of my pelvic floor where it engage when I exhale. And anyway, so those are the things that Janice had taught to me in terms of, like, it's not just necessarily it's about all strength, like you have to strengthen your glutes, your core, but it's also about neuromuscular,
Education.
like the timing wherein you fire those muscles, the connection of it when you actually do activities. Is that correct, Janice? I hope I learned so much from you.
Yeah, and I hope, I think we covered a lot in that one session,
Okay.
right? Yeah.
Okay, good. Good. So
So
now
yeah, we
go.
remember we hanged you up, and we found out that you did have this instability going on in your, I think it was 4L45S1,
Mhm.
and that you could still brace it actually. And so I had to teach you how to use your transversus abdominis and your lower pelvic floor. But in
Sure.
order to
Yes.
truly learn how that feels, that's why I had you in the new rack, because when you're suspended face down, it's easier for me to isolate your, because you're suspended, not, there's no gravity working in there. So what I
Right.
did
Right.
was I brought your spine into a slightly flexed position and had you turn your pelvic floor, and I would tell you to turn it on, because, and then so that, and then the goal was for you to hold it for about a minute or two, so at least you could feel what that felt like.
Oh
And
yeah.
when we tested that, if you could turn that on, your glutes were actually could fire
Right. Right.
better, and you could stabilize your hip better, um, more when you had it turned on versus when you have it turned off, it was quite weak. So you can see, it's not a weakness that's caused by uh, like just lack of strength or not exercising. It was just, there was just not enough neuromuscular re-education right
Yeah.
there. So
Like, I just need to know how to talk to my muscles. That's what it is. All right. Well, let's go back. I know a lot of our athletes actually wanted to find out. Well, so if we have low back pain, there are a lot of things that we have been doing. Rest,
mhm.
rest. muscle relaxer, there's Advil, but then sometimes Advil doesn't work. So a lot of athletes like, what else can I take? Or should I go use the TANS, right? The TANS, or go chiro visit. What else can I do? Or should I take MRI? Okay.
Yeah.
Or so what would you suggest if, like, for example, someone is having low back pain? And I'm sure
Do
there's
not
different
wait.
levels.
My number one, so, you know, pain is very multifactorial, okay?
Sure.
As an OMPT, so my concern is really more biomechanical. And so when I say biomechanical, means what's going on neurologically, musculoskeletal wise, what's going on in there. So medication wise, I'm not a big fan of it because it masks. I mean, if it takes away and allows you to sleep better, go ahead. But the first thing, do not wait if, the good, what people don't seem to understand is that we have your physical therapist, we now have direct access. You can see us straight without a doctor's referral. If you have back pain, go straight. Wow. You don't need a doctor's referral, okay? And if you have that address right away, and at least you know that, okay, the OMPT can tell you, okay, this is a musculoskeletal issue, this is something we can work with, fine. But when the PT says this is something you might need a steroid because this is a disc herniation, you need to go to your physician, at least get a steroid pack or metro pack or, whatever they could give you that's anti-inflammatory. So and then an MRI. Is an MRI really necessary? Not always, because the pain does not always reflect where the pain is coming from is not what's showing on the MRI.
Oh, okay. Gotcha.
Yes.
Gotcha. Okay.
But that doesn't mean that you don't need it or not, you don't ever do it, okay? Sometimes, like, it is really truly necessary just to see what's going on. Imaging is necessary. But at the same time, the earlier the intervention is, the better the outcome is, okay? If you keep on ignoring it, oh, you know what, it went away. And then suddenly you're in your 10 years after, you're like, oh my God, this is so much. Why didn't we do it? Yeah. So in hindsight, of course, we want to be proactive, but there's also a lot of other things you can do. So, when you're, like I said, that's the role of a PT. And then the TENS unit. So it's all, the TENS unit works if it's used correctly. But
yeah, right.
The problem with this mass production of TENS is that the settings are always wrong. When people use it and put it on, they don't know how to tweak what setting it's supposed to be on. And two, what tissue are you targeting? Is it the bone? Is it the cartilage? Is it the ligament, the muscle, or a nerve root? There's specific settings in those. And how do you know that that's what you need to target? That's where we come in, your medical team come in. But it's
gotcha.
Yes, or the PT or the physician, right? So that's where it come in. Now, spinal manipulation. Like you said, right? Cracking of the joint.
Yeah. So there are some athletes, like they just feel some crack, right? They do it on their own. That's not me.
But I mean, it works if that motion is okay. If you're manipulating a segment that's not moving well, so that the segment so that it takes away the hypermobility, because usually what happens in a spine is there's one segment that's moving too much and one segment that's not moving at all.
Okay.
Right? So why would you manipulate the segment that's moving too much?
Yeah.
Right? You manipulate the segment that's not moving so that when that moves, the one that's moving too much doesn't have to move, and then so it doesn't irritate that well. Okay. So usually the hypermobile side is always the one that's painful. And the hypomobile is the quiet culprit that doesn't have any symptoms, but it's actually the cause as to why that segment is hypermobile. So you want to manipulate the hypomobile segment.
Did you guys hear that? Oh my goodness. Are you guys taking notes? So hypomobile. So, well, I guess, well, not I guess, the real lesson is that just be very careful whatever you're doing with cracking your back. But yeah, so there are some athletes who are actually, they hear some crack when they move something. So they were asking about that.
It's okay.
I'm sorry, what?
Sometimes the sound just feels good. I think it has a placebo effect.
Yeah.
I know
So,
it cracked, it popped. Oh, I can move. I don't know. Yeah. But
so
no, there has to be some specificity to what you do. You can't
sure.
do
Oh yeah,
that
of
because
course.
it feels good. And
Yes.
so that's where a PT and a chiropractor comes in.
Yes.
There has to be some specificity to what you do. You can't just
Yeah.
have somebody manipulate one segment without knowing, is that really, you have a segment that is already unstable. Do you really want that to be manipulated?
Right. I
Right?
totally agree about that.
Yeah. What are you going to manipulate? Why would you want to crack a segment that already has a disc that has a fish, or there's a fissure, the ligaments are already unstable, it's already lax. So why would you have that manipulated, right? So it's always the silent culprits that needs to be manipulated.
Those are very good, Janice. So how about like bouncing activities like running, or
Mhm.
like for example, there's a bump, let's just say cycling, there's a bump, there's this vibration, and
Vibration.
there are some athletes that receive like shock or just shooting pain. When they feel it at that time, I guess what would you recommend or advise what they do at the time? Do they rush to the doctor, call physical therapist, or like do they stop the workout? What
My
exactly can they
advice
do?
would be, okay, if the pain is something where you can figure out what motion is bringing
Okay.
on the pain, like you can reproduce the pain. When I go to this side, that's where it hurts, but when I
So you
go,
don't go there.
yeah, like,
Okay.
usually patients will tell you, when I go to
Mm.
this side, that's when it hurts, but when I go this, it doesn't hurt. Oh, it only hurts after I run 10 miles. It only
Sure.
hurts after
Yes.
I do trail, or it
So
only
don't
hurts
go there.
when
Right.
I'm wearing this shoe.
Or heels.
Yeah. So they can, like, it's reproducible, but at the same time, the pain is not constant. It only occurs when they move to a
When it
certain
happens.
range and do a certain physical activity. Then that's a really good indication that it's really something musculoskeletal. It's mechanical low back pain. This is something
Hmm.
that a physical therapist can work with you.
Got it.
But if the pain only comes on early, like late at night, and it's
Sure.
constant, and you've had some recent weight loss, and you haven't had any of your annual physical, and no matter whatever you do, the pain is constant, like you cannot figure out what events, that's something of concern. Because if, as a PT, if you have back pain and nothing just fits the pattern, not everything I do, I cannot find anything that's positive, everything is a negative, but
Okay.
everything that it's just nothing fits the pattern, I would be serious, like
Ooh,
really concerned, and so you'd better go to your physician,
doctor.
right?
Okay.
Yeah, because this usually we can tell that if it's this could be something that be telling of something like aneurysm, or it
Mm.
could be a referral of something that's a cancer that's already brewing in there.
Yeah.
And so those are the things that it could be, or the pain is so severe that it might be something that's like a stress fracture already,
Yep.
or yeah, that's, or a
Sounds scary.
fracture, yeah. So
Yeah.
that's where also, if it's something, and if you're not really sure, go see a PT, and and if they're trained in that, they can actually tell you, this is not something that I can address as a physical therapist, you need to go back now, like, to your doctor. And
Gotcha. Okay, got it, got it, got it. So, but yeah, you did mention like right now, people can actually access the PT like immediately instead of going through the physician. So
in
they don't really need referral.
California, we're a direct access state. Most of the other states also have direct access. It's just with certain limitations by how many visits, but you can see a physical therapist directly without needing a physician referral,
Sure. So,
unless your insurance says, but sometimes it's not worth it sometimes, because it depends on your copay and all that stuff, but that's a whole other conversation
got it, got
about
it.
insurance and stuff, and that's like,
So when an athlete hurts, so let's say he or she doesn't like go to that direction or like go over 10 miles, let's say. But heat compress, is that something that you would advise? And how
heat,
long? Or is that something that would
heat
help?
is relaxing, yes.
Okay, relaxing. But
Heat is
with
relaxing,
itself,
but you don't want to put heat if you have an acute injury, right? If it's
yeah,
cold,
of course. Yeah, no.
you don't want to put heat, you don't
That's
want to put,
different.
yes.
Yeah.
Yeah, so heat works, but it's not It's
permanent.
not a permanent. Yeah, it's
You
not.
don't know the root cause either.
Yes. You
But
have to go to where is the weakest link in your body that's giving you that mechanical low back pain.
okay, okay.
Yeah.
So does that mean, let's just say, I guess different levels of pain? Is running not okay then? If there's pain, then I guess not, right?
No, it depends.
No, it
Yeah,
depends
I
too. So
don't
it
think,
depends
yeah,
on how bad the pain
depends
is
on where
also.
the culprit. So the bottom line is when I assess a patient with low back pain and you're a triathlete, I'm
Mm-hmm.
going to kind of figure out where is the weakest link.
Gotcha.
Where is the weakest link and what is driving your pain
Mm-hmm.
symptoms. Okay. And we address that. So whether it's an acute posterolateral disc herniation, whether it's a functional instability, or is it something like a uh, just a decreased hip motion that's causing you so much stress. So that's where we kind of figure out. And from there, then we can, how do we modify your running, or how can we have you return to running as soon as possible? Because
Gotcha.
movement is by itself is really just a form of therapy. We call it mechanotherapy. So if we go by the cellular, but the biology of it, we call it mechanotherapy. When you move, you are actually providing a mechanical stimulus to the individual cells of your body, and you're causing that individual cell to respond in a specific manner, which includes even change the genetic expression of a
Wow.
cell. So that's how powerful moving
Wow.
can be, right?
Wow.
But that's how much research is about when it comes to mechanotherapy. Is when you move, you can actually change how a cell responds by either causing it to replicate, by causing it to change its shape, or to deform, or how it responds. So your movement. The only problem with that kind of biology process is to figure out how much resistance you should give, how much stimulus can you give to a
Gotcha.
specific tissue. And that's where the research
That,
has not progressed very much yet. So
got it.
yeah,
Got it.
should you move if you have low back pain? Yes, you'd better move.
Other things that, aquajag would help also while they
Yes,
recover until
yes,
it's much better.
yes, in a decompressed state. So the bottom
Okay.
line is low back pain, figure out where is the culprit. Then
Okay.
you can figure out which specific movements are better for you. It's not about, you're going to rest. No, you're not going to rest. It's an active rest. You have to move. It's just, you just need to figure out what are the right movements for you.
Wow.
What muscles are you going to use?
Yeah. Yeah. Because it's funny, even though like even swimming, that's low impact. Like
Yeah.
we have actually, Sandra was asking a question. I'm having back pain after I get out from the pool from not stretching enough, because so that's a possibility too, right? Or
So if you're
overextend
having
back
back
maybe.
pain from after swimming,
Mm-hmm.
then that's where a swim analysis comes in. Okay. Because
Mm-hmm.
swimming there's a hip drive, there's a lot of rotation, there's a neck rotation, there's an arm. So where are you rotating from?
Swim analysis.
So where are you rotating from? So that's where, when I assess somebody who's swimming, is that where is your restriction? Are you not able to rotate to the right, or you're not able to rotate to the left? When you do your freestyle kicks, are you, when you are not extending a lot on your hip, and when you're not able to reach the full extension on your hip, guess where you're going to extend from?
Back.
Your lower spine.
Yep.
Yes. So that's going to feel sore. So
Mm-hmm.
there's a lot of, that's where you figure out, okay, why does it hurt after I swim? Something is not, there's a weak link in there somewhere. Okay.
Yep.
So that's where it
So,
comes in. Yeah. Your
yeah.
technique.
Yeah. A lot of my experience is actually a lot of athletes are overextending their back like
Yes.
that. And then when they kick, that's when you were saying earlier that the firing is on the back rather than on the glutes when
Yeah.
they're kicking. So
Yeah.
when you do like, and then it hurts. It happened to me before, so I know so well. Okay, let me just. I know we're running out of time, but let's see this one. I'm having pain after driving or sitting down on my left side way, especially after run bike. I had sciatica on the same side.
So
Huh.
sciatica means it's almost synonymous. So the doctors give that as a generic term just to kind of explain what. So
Sure.
he's having pain after sitting?
Yeah, yeah.
So she's putting a lot
Sitting,
of pressure
sitting
on
or
her body.
driving,
Yeah, so
sitting
it
or
gets,
driving.
yeah.
I'm sure you don't have to be
So
an athlete to be sitting or driving. So here you
yeah.
go.
So that means you might have a piriformis or a glute max that's more in a, I call it weak muscles panic, right? So they're trying
Mm,
to panic because they're weak, because they're inhibited from firing because of something that's going on to your low back. So they're always panicking all the time because they always want to move. So that's where sometimes it feels like.
I see. I see. I
So
see.
like you want to release it. Okay. And sitting
Right.
is also a lot of pressure on your sitting has already been known to cause the stress load on your disc is a lot more than when you're standing actually. So that's what they call it sitting instead of you smoking.
Yep. Actually, Vineta works the entire days, entire day standing up, no seating. I don't know how she does it. Another athlete mentioned, how about supplementation? Supplements, is that something that
Supplement.
works?
Oh,
Yeah,
okay.
glucosamine.
Bone health, tissue health.
Yes.
So this
What do you think
what
about
I
that?
would suggest is you get a supplementation is everyone is, our electrolyte, our body makeup is all different. We all have different things going in our life. I would suggest sometimes if you have the means and you have access to is get a functional medicine consult is where
Mm,
and they can really look at what's going on in your entirely and what supplements works with you
there
best.
you go.
I'm no expert in that, but I do have my own functional medicine practitioner that I use as well. Even I myself see one because I need help with what's going on and what are the right supplements for me. So there's a lot of studies out there, but figuring out what works best with you, go see a functional medicine practitioner.
That's very good advice. Okay, well, we're running out of time, Janice. Thank you so much. But before we end, how about give us top three things that you would advise our athletes, our badass athletes who just like love working out, but suddenly there's
Oh,
back pain. What are the top three things that
suddenly back.
that they
Okay.
would do to prevent or to solve, just so they
One
can
is
train
my
freely?
best my best advice, sleep.
Sleep. All right.
Sleep.
So
Um you need a really good 8 hours of sleep. And I used to think 6 hours was enough. Number one, 8 hours of sleep. You need, okay, to get the full benefit of sleep, you need to reach stage 4, right? Your REM. How
yep.
long does it take you to get to REM? 6 hours.
Mm-hmm.
So by the time you get to REM, you should have slept already 6 hours, right? How many REM hours of sleep do you need? At least two. You gotta have 8 hours of solid sleep.
Gotcha.
You don't sleep, your heart don't get a rest. So don't be surprised if even though you are an athlete and you exercise so much that you wake up one day and your doctor will tell you you have congestive heart failure, but you've never smoked nor drank a single day in life. Okay. So that is one of the biggest culprits right now in our society is sleep.
Yeah.
And two is movement is always your friend. Okay. Do not be scared to move. The more you move, the better the nutrition. You know, a lot of people sometimes advise them, don't run because it's so much impact on your knees. And I said,
Sure.
that is the most craziest thing I've ever heard. You know, so, research have already said that if there's already a research where this that even 30 minutes of cycling can actually regenerate cartilage tissue. Two, movement is what brings nutrition to your joint, but at a certain range. Okay. You have to be able to hit a certain range in your joints because that's when that's when the bones absorb and the cartilage absorb those nutrition that brought on by those fluids in your knees. So that's where it's stretching is important.
Okay.
That's why in the
Okay.
morning for people with arthritis, they feel that stiffness, but when they start moving, it
Stretch
moves away
better.
because
Uh-huh.
your joints absorb those fluids away,
Gotcha.
right? And so you feel better. Moving always does. So, and then if you really want to get rid of low back pain, then have your PT figure it out.
Gotcha.
Where is the pain coming from? And
Sure.
what is the driver of that pain? Simple as that. Nothing complicated.
Okay. Well, those three things are very important. Sleep, movement, and then see the PT, especially for professional help, just to be more specific. Because sometimes we do our best to solve it on our own, But if
Yeah.
we want a more of a long-term solution, which I
Yes.
actually have, I still do, because sometimes I don't know everything, but I go to the professional help,
Yeah.
someone who's really experienced. If there are so many questions that you've already helped us, Janice, but I'm sure there are a lot of athletes who would want to reach out to you, and maybe not even an athlete, anyone who's actually experiencing low back pain right now. How could they reach you?
I'm on Facebook. I think I'm
Okay.
tagged on this one. Yes. And
Okay.
then I think we just have our website. My husband and I are both PTs. So our website is
Medicine.
movementpt.net.
Okay.
I would say direct message me on Facebook. It's a lot more
There you
fast.
go. Sounds good.
Yeah.
Sounds good. Well, everyone, I'll make sure I get the information of Janice once we post the replay of this one, or we update with the updated caption. We'll make sure that we add Janice contact. We will have the replay in YouTube, and also our Feisty Fox Fire podcast will have all those information. So if you have any other questions, and I hope you have been taking notes. Again, thank you so much, Janice. It's been a pleasure. And I'm sure a lot of athletes have opened up their eyes of all the things that you have actually taught us in this amount of time. Very valuable. Thank you so much, Janice.
Thank
Till
you,
next
Jen.
time.
Okay.
Okay. Bye, everyone. See you on our next live show.